you have the Republicans that are going to be facing a tough re-election in 2018, and a bill that's extraordinarily, I think, extraordinarily unpopular. They didn't read it, couldn't read it until 8 o'clock last night. 8 o'clock last night to reorganize 1/6 of the economy. They don't even have a CBO score on it for a country that's $20 trillion in debt. They have no idea how much it's going to cost. They have no idea how many of their constituents are going to be kicked off of the health care rolls. 24, 25 million nationwide. How many are in their districts? And yet they're going to jump off the cliff just so they can get a headline that will burn away into the mist within 24 hours. Trump will tweet something else, and they'll be on to something else.
So on one side, you have what you said, unscored, unread, untested policy that will be considered risky by many of their constituents and many healthcare analysts, and a very shaky future, to say the least, in the Senate. On the other side, I think there are three things that are the reason why you're going to see a vote today. One is, if House Republicans and the White House can't make good on a promise to repeal the Affordable Care Act after 7+ years, they can't do anything.
But Mark, why do they do it today? This is not the end of the world. They're not they're not Pirates of the Caribbean at the end of the world, and they're on the ship with Johnny Depp, and it's about to go over the end of the world. They have next week and the next week. They can wait for the scoring to come back. They can do something really radical. They can read the bill that they're voting for. Nobody there has read the bill.
Because if they wait for the scoring, it's less likely to pass.
Why?
Because there'll be a political uproar. But
well, exactly. So you're saying that the leadership is forcing the members. You just answered my question.
He walked
right into it. The leadership is forcing members who are already vulnerable to take a vote before they find out how vulnerable their seats are going to be. And they're going to be sitting around wondering why Nancy Pelosi is sworn in as Speaker of the House on January the 4th, 2019.
There's one of two options if they go forward with this, and whether it becomes law or not, as you said. One is that they sell the country on the fact that this is better for them than the Affordable Care Act, if they can do it, which is going to be a challenge. Or two, they lose their majority, but they feel good because they got rid of the Affordable Care Act. Those are their choices. I think a lot of these members are willing to lose to fulfill this promise, but they have not produced a bill that they understand or that they can sell today.
One other
but they've got to pass it today, or they'll never pass it.
They got to pass it today, or else they'll find out how bad the bill is if they actually read it, and then their constituents won't let them pass the bill. That is political day trading, and it's stupid, it's short-sighted. And let me just say something else. It's never going to pass the Senate. So your statement that they want to go back to the district and say they repealed Obamacare is not something they're going to be able to say, because the senators are going to look at this and go, are you kidding me? What's wrong with you people? It's not
unless the Senate changes the bill in a way that then House members feel compelled to vote for with a different coalition, maybe lose some Freedom Caucus people, but get more moderates. They have to try to fulfill this promise. I understand all the risks they're taking, and they do too, but they have to try, or I think they'll never pass a major piece of legislation.
Okay. So, Steve, you're taking a closer look at the potential impact on people with pre-existing conditions. You have charts on that?
I have charts. But let me just say one thing. Look, the last bill was scored, right? And we know 24 million people lost insurance. This bill was moved to the right to get the Freedom Caucus on board, so we know that it is less patient-friendly than the last bill.
So you think the 24, 25 million could go up?
Well, it's going to move around because they're going to allow people with to not get all the benefits, and we're going to talk about pre-existing conditions. But this is a worse bill for the average American than the bill that was scored by the CBO. So we know how ugly it is, and yet they are voting for it. Okay, charts.
Charts.
So look, let's talk about pre-existing conditions. Under the Obamacare, you could not charge people a different amount of money if you had a pre-existing condition. This bill would allow states to opt out of that requirement. And this chart shows, and I don't have my magic pencil today, but this chart shows.
No magic pencil?
I know. It's, what can you do? This chart shows what could happen to premiums for people who do have pre-existing conditions. So if you are really terribly ill with metastatic cancer, your premiums could go up $140,000. If you are simply pregnant, your premiums could go up $17,000.
Pregnancy is a pre-existing condition?
It's a pre-existing condition. And they could charge you more if you show up pregnant and say you want health insurance. If you have asthma and you show up and you want health insurance, they could charge you. They could charge you more. So this is what consumers would be facing before you get to any action by the government.
Autism, $5,500.
And I will tell
By
you,
the way, for a family in central Pennsylvania that voted for Donald Trump, who find out that their child has autism and needs treatment, and they're struggling just to pay their rent, and they find out that because of Donald Trump and the Republicans in Congress, they're having to pay $5,500 to help their autistic 4-year-old child. That's not a 90-10.
So
that's going to get them in trouble.
So I tweeted a version of this chart out yesterday. It got 20,000 retweets. I have never sent out a tweet that got 20,000 retweets.
Of course, a lot of that.
But just for the politics.
We're going to tweet this all again.
Just for the politics, just to give you a sense of the politics of it. Now, so what does the administration want to do about it? They want to set up a fund to provide some subsidies for these pre-existing conditions. But by one estimate, you would need $330 billion over the next 10 years to subsidize this. The new bill had in it $130 billion, but that could have also been used for some other stuff. You see that little blue sliver at the bottom?
That's 8.
That's the $8 billion.
So
that's the idea that this made
a short.
a little short. A little short, but the idea that $8 billion on $330 billion change people's votes is kind of hard to imagine.
So here's what I don't understand about, again, the political. There's so many things I don't understand about my party's political calculations here. It's mind-boggling. One of the things I don't understand about Donald Trump's political calculation, though, is by all measures, the people who are going to be hurt the most are his voters.
Can we just get to that? Because Alex is talking to me. Get to the next chart because it's going to answer that exact question.
Really?
There you go.
Really?
Okay.
That exact question.
Well, there you go.
Did you actually do your homework and look at these?
No, I didn't.
No.
I was in France.
So,
Never does.
So, by some estimates, about 27% of Americans have pre-existing conditions of one sort or another. The top 10 states to exceed the national average in pre-existing conditions are all Trump states. Here are 5 of them that I've listed here: West Virginia, Mississippi, Kentucky, Alabama, Tennessee. So to your point, and for obvious reasons, a disproportionate number of people with pre-existing conditions are in Trump states.
And you know what states you don't see there? You don't see Wisconsin, you don't see Michigan, you don't see Ohio, you don't see Pennsylvania, you don't see states where Barack Obama voters switching to Donald Trump gave Donald Trump the presidency. Well, those maps that Donald Trump's passing out to everybody right now, if this law passes, you can just paint those
Maybe
top
somebody ought to
4
hand them
states
Steve
blue,
charts.
because those people are going to go back and vote for somebody else if this passes. Right? They're the ones that are going to be hammered the most.